Hello, everybody, and welcome to our Indiana Perinatal Network monthly webinar. My name's Margie Searle, and I'm excited to be presenting a post for this month's topic, which is called Outside Indiana, Relationship Building in the Breastfeeding World for Powerhouse Results. First of all, we'd like to thank our two sponsors, Indiana WIC and St. Vincent Health, without which their generous sponsorship, this great breastfeeding webinar would not be available. As I mentioned, my name is Margie, and I've recently been hired by the Michigan Department of Health and Human Services. I am the state breastfeeding coordinator, and within a relatively short amount of time, I was told to communicate and network with Tina Cardarelli. And as anybody who's met her knows, she is all about mentoring and relationship building. So we've been working on some exciting collaboration between Indiana and WIC, and we'd like you to stay tuned for upcoming news. We have two sessions today, and I will be discussing our first session, which discusses a great collaboration between inpatient and prenatal and postnatal care in a baby-friendly hospital here in Michigan. So as those of you who know who work with breastfeeding moms, one of the major issues that we have as a barrier is continuity of care. And we have many obstetricians who make comments such as, "Oh, I don't need to talk about breastfeeding, they do that in the hospital." And then we spend all of our efforts and love with those moms for those brief 24 hours in the hospital, and so oftentimes they're lost to follow up afterwards. And rather than lamenting that fact, Sparrow Hospital, as they went through their baby-friendly hospital, decided to address that head-on and see what they could do to prevent that from happening. So I'm so excited to offer to you today two speakers to talk specifically about how they did that. And the first is Kathy Marble. And Kathy is the Director of Women and Children's Services at Sparrow Hospital, and she was the previous NICU nurse manager, clinical nurse specialist. She's been the outreach transport coordinator and neonatal nurse educator. She was an instrumental leader in Sparrow's path to become baby-friendly in 2015. Kathy is an inspiring breastfeeding advocate, and she works tirelessly to forge relationships in her community. And I'm really excited for you to hear how she's created partnerships with our local obstetrician community and with WIC to help improve the continuity of care there. And assisting her with this presentation is Tracy Bolton. Tracy is a registered dietitian and an international board-certified lactation consultant. She received both her undergraduate and graduate degrees at Michigan State University. And Tracy has worked with the WIC program and MSU Extension for 23 years. From local agency to the state level, providing direct services, as well as conducting and publishing research. She's now the coordinator for Ingham County Health Department and was instrumental in the Get Real About Breastfeeding campaign. And without further ado, I'm going to turn the presentation over to Kathy and Tracy.
Good afternoon. This is Kathy Marble, and Margie, thank you for that wonderful introduction. So I want to first give you a little information about Sparrow Hospital. We are in Lansing, Michigan, our state capital. We are a 700-bed hospital, a level 1 trauma center. We have a level 3 NICU with 4,300 deliveries annually. So busy place. And as Margie referred to, we did receive our baby-friendly designation in 2015. Are extremely, extremely excited that that happened for us. Did take a lot of work though, and the one thing that I'm going to talk about today, as far as the presentation that Tracy and I are going to do, is that coordination on the front end of these moms that are coming in. We have a select group of women that we know that will be coming to us in 9 months, and all the education that we can make sure that they get on the front end, and so that we're not overloading them once they become our patients here in the hospital for 24 hours. So as a part of the baby-friendly journey, we did recognize that it was a continuum of care. And I'm going to forward my slides here. Sorry, I'm going to back up. I included the pyramid, our Sparrow pyramid, just to make sure to keep us focused that the patient is always at the top of the pyramid, no matter what we do. And in this case, it is our new families that we keep at the top and making sure that they have support that they need to make sure that they have successful breastfeeding experience. Hang on. This just gives you a little bit of, how come the slide isn't advancing? There we go. Shows you a little bit about the area of coverage that we have at Sparrow Hospital, our counties that we do cover. So onto the outreach portion. When we were working on our baby-friendly journey, we did identify that we needed to pull in those OB offices, the family practice offices that were going to then see their patients here in our postpartum area and labor and delivery. We identified those offices and key people in there. And the key people that we need to communicate with were their office managers, and then identified nurse that could help communicate the message to the patients. So once we had identified that, we had them on an email list, and communication started happening. So we developed information that prenatally a mother would get at her first visit, at her second visit, and we just slowly provided information until it was her last visit before she was going to deliver, and things like skin to skin, rooming in, that makes sure that you bring someone with you that can help provide care to the baby, because we don't have a nursery, and that we want to support you in your breastfeeding efforts, and it's important that the baby's in the room with you. So those were kind of some key things that we wanted to make sure that the offices were communicating. We did initially go and do a site visit with each of these offices to provide some written information for them and to communicate the message face-to-face with them. Then after that point, we began quarterly office managers luncheon. So we provide food here at the hospital. It is during the lunchtime when the office managers and their nurses can come on site. Typically in the room we have 30-ish people that will show up. We provide handouts for them. And the planning of the agenda, it's generally myself, our clinical nurse specialist, and then the managers in my labor and delivery and mother-baby area. And we put together the agenda, send it out ahead of time to this office staff, and then the day of the presentation, we have everything divided up on who's going to present what information. So, and in addition to the office staff attending, we make sure that our WIC maternal child health division supervisor attends as well, so that it provides seamless transition from our hospital environment to the home. So we've seen with this collaborative effort, moms coming to the hospital with a greater understanding of what's going to happen to them. They come prepared for their labor and delivery experience and their postpartum, what it's going to be like. That we have seen less questions and more preparation on their part. And in addition to our quarterly meetings, we've also implemented peer counselors, and we were able to bring our peer counselors on through our volunteer office here at the hospital. We onboarded them through volunteer services, and we have peer counselors on site in our maternity ward to help facilitate breastfeeding and make sure that our moms are successful. We also have a monthly infant feeding collaborative, which is just the best thing ever. It really grew out of our baby-friendly work. It was the group that met very often as we were planning our journey up until our site visit. And then following our site visit with Baby Friendly, it turned into our collaborative. And so we have leadership from all of our units, pediatrics, the NICU, mother-baby, labor and delivery. We have lactation consultants. We have support from the health department that's there, WIC. So it's a great collaborative effort. Our new hires into the unit, and we most recently have hired a slew of maternity nurses. We're making sure that patient, as they start their new experience and working on maternity, that they have breastfeeding education during that onboarding time. So we make sure that they're able to then go out and help mothers be successful. We do have WIC on site in our maternity area, and Tracy's going to address that in a few minutes. Community support as well. We have a baby cafe, and she'll address that in a minute. And then I did already talk to you about the peer counselors on the unit. So with that, I'm going to invite Tracy to the microphone.
Thank you so much, Kathy, and thank you, Margie, for a great introduction. The next slide, we're going to talk about the lactation support clinic that Sparrow has started. It's held every Tuesday and Friday afternoon. Each clinic is staffed by a pediatrician with expertise in breastfeeding support, as well as a lactation consultant that is employed by Sparrow. It's held in our pediatric subspecialty clinic area, which just is right across the street from the hospital, so very easy for our inpatients to be able to again locate. Referrals to this clinic are made by the provider while patients are inpatient or once they're discharged either by their OB or their pediatrician, as well as lactation consultants or public health nurses that identify a need for a mom and baby to receive additional clinical services. And this clinic supports our mission and our efforts, and Sparrow's efforts to continue to be baby friendly and support our breastfeeding moms. Onto the WIC and Sparrow collaboration. It begins prenatally with our WIC prenatal classes. All of our clients are offered the opportunity to attend an infant feeding class. And the type of class that they attend is tailored to them based on what they desire about infant feeding and where they're at on the spectrum of interest in breastfeeding. But at these classes, we always make sure that we also cover what to expect in the hospital, such as the things that Kathy mentioned are some recent changes with becoming baby friendly that help support breastfeeding, like skin to skin and rooming in. Then also, as Kathy mentioned, we are doing hospital visits now. So 3 days a week, we send 2 WIC staff members to the hospital to see inpatients. There we add their new babies right onto the program so that once they're discharged, they don't need to actually come into the WIC clinic and attend a WIC class, or attend a WIC appointment. All of that is done right in the hospital. The staff that we send 1 of 2 RDs each day, and those dietitians both have additional training in breastfeeding support. One is a breastfeeding, an internationally board certified lactation consultant, and the other one is a certified lactation counselor. We also send a clerk to complete the other part of the WIC enrollment piece, and she has also attended breastfeeding basics, so she can provide basic support and answer some basic questions, and then refer to the dietitian that comes in just behind her to follow up with more clinical advice and expertise. So the staff that are visiting the patients while they're here in the hospital reinforce the infant feeding education that the Sparrow staff have already given. So our education goes hand in hand. And having WIC present at those infant feeding collaborative meetings, as well as the OB meetings, make sure that that education is seamless and consistent. There was a process that we had to go through as health department employees so that we would be given access to Sparrow's system. And those things included additional HIPAA training that was specific to Sparrow Hospital, EPIC training, which is their electronic medical record system. We have read-only access to that system so that staff can identify the pieces of the enrollment that they need to enroll the babies into WIC and to recertify the moms as postpartum. Those things are like height, weight, hemoglobin, that type of thing. They also we have to provide current TB testing or proof that that has been done. And we went through some security training also so that we have ID badges that access the floor that we need as well as the employee parking. There was no additional burden to the clinic. One of the common questions I get about this plan or comments that other people make that say they can't provide this type of service is that they can't spare the staff from the clinic. Well, those appointments would need to be held in the clinic if they weren't being held at the hospital, so we simply relocate the 2 staff that would have participated in the enrollment on site, off-site to the inpatient facility so that it is more convenient for the family. Finally, we schedule a follow-up phone appointment with our breastfeeding peer counselors. For all of the moms that are breastfeeding, either attempting breastfeeding, considering breastfeeding, open to breastfeeding, successfully breastfeeding, anywhere on the breastfeeding continuum, we schedule a follow-up phone appointment with our peer counselors so they can make that call within 48 hours to provide additional support and encouragement to those moms. Then the additional community postnatal support that we provide as a community, one of those things is called the Baby Cafe. This is a collaboration of community partners to provide a weekly support group that's open to all breastfeeding moms and their support people. So dads, grandmas, anybody is welcome to come. This is currently held in a church that is supportive of the mission. Expectant Parents Organization is the agency that holds the license, and Sparrow as well as Ingham County Health Department provide peer support as well as more expertise in the International Board Certified Lactation Consultant support. And with that, I will thank you and turn it over to Julie Lothamer. Julie is a registered dietitian and an International Board Certified Lactation Consultant. She received both her undergraduate and graduate degrees, also at Michigan State University. Julie has worked with the Women's, Infants, and Children's WIC program for 20 years, from the local agency to the state level. She is now the State of Michigan WIC Program Breastfeeding Peer Counselor Coordinator, and she is also the co-chair of the Michigan Breastfeeding Network and a member of the Michigan Department of Health and Human Services Breastfeeding Initiative Task Force.
Thank you, Tracy.
You're so welcome.
I'm hoping all this technology and getting my screen correct. So, thank you for Indiana for having us on this webinar. And let's like to share some of the things that we're doing here in Michigan to enhance support in the WIC for IBCLC's program. So over the course of my next little bit, just want to share with you several things, some Michigan in the news, a little bit about our demographics here in Michigan, a history of what we've done for breastfeeding support in the WIC program, some of our new policies and some grants that we've been working on, and then also some Medicaid policies and some next steps. So unfortunately, Michigan has been in the news for not some great things lately. So we've been working really hard to support lactation services in some of our really high need areas. We've been known for years for our high infant mortality rates in our cities of Detroit, and then more recently for the lead crisis in Flint. And so as these things come up with the emergencies, it makes it even more important to talk about how we support these moms with breastfeeding. So a little bit about Michigan and our caseload in WIC. We serve about 53% of the infants born in Michigan are WIC eligible. Our caseload hovers around between 25 to 243 to 250,000. We have local agencies is how our WIC works, and we have 48 of those. They serve all 3 of our 83 counties. Our initiation rate statewide is a little less than 65%, and we struggle with duration in our state, and we have our duration rates with our moms that are participating in the WIC program. We have a little less than 17% that are still breastfeeding at 6 months of age. In the WIC program currently, we have 23 IBCLCs in the local agencies, and then we have 5 contracted IBCLCs. And then here at the state level in a permanent position, I'm the IBCLC at the state level. In Michigan, currently, when we look at all practicing IBCLCs, we have about a little over 330. When you look at Michigan and our mitten, most of our IBCLCs reside in the lower half of Michigan with large pockets in our more urban areas around southeast and southwest Michigan. And we have 84 birthing hospitals. And in the Upper Peninsula, we have 8 birthing hospitals. And in that area, just to give you kind of an idea, if you drove from our capital to the tip top of the Upper Peninsula, it would take about 8.5 hours to go. So we're not always, we cover a huge geographic area. Currently, I believe we have 12 baby-friendly hospitals, and that number is increasing. We have several more on the pathway of becoming baby-friendly. So we look at in our state, one of the other things that we've looked at is our racial disparities. And it's funny how we have a lot of ethnicities hovering right around 70% initiation. But in our African-American population in Michigan, only about 53% of our African-American families or mothers initiate breastfeeding. So when we started looking at that, we definitely knew that we needed to make sure that we were getting training to all parts of the state and training more people. And so we actually have been since 1993 operating a peer counseling program. We partnered with our Michigan State University Extension program when the Loving Support first came out, and we had peer counselors that were working through MSU Extension and providing home visits. We also started in 1993 contracting with state IBCLCs for some services to provide support for them. In the late 1990s was the first time in Michigan we offered the Certified Lactation Counselor training. And since then, we have now transitioned over to a Certified Lactation Specialist training, which is a 5-day training that we offer every other year. And then in this year is our first year we've just done what we call our Advanced Clinical Skills training. And so for any of our staff that has some sort of lactation specialist certification, this is a hands-on 1-day training where they come in and kind of can refine their skills and work with and be mentored by other IBCLCs. So as part of this training and growing our IBCLCs, we use that CLS as a stepping stone to grow IBCLCs. And then in addition to that, we also offer the continuing education through conferences and seminars. We always have a WIC conference that has a breastfeeding track that offers between 5 and 7 CEUs for that conference, as well as an annual, what we call our statewide breastfeeding peer counselor day that also offers a few more CEUs. And then in addition, we provide study materials at the state level. So we utilize the Linda Smith's lactation exam review. We give the breastfeeding atlas. And then we have all of the local agencies are approved to use local funds to support exam costs, whether that's to actually pay the fee for the exam, offer a review course, do partial payment. or even just pay staffing time for them to take the exam. So several years ago, we decided that it was important as part of our program to be able to offer the full array of services within WIC. That means from support from starting at a peer counselor level all the way to being able to provide more clinical services from an IBCLC. So in 2012, we started talking and preparing our local agencies that we were creating a policy that would require all local agencies to have an IBCLC within their agency. So the talk began in 2012. In 2014, the policy came out with the requirement of October 1, 2017 of that. So we're fastly approaching that. We have created a job description and specific duties for the IBCLC. The goal of having this is to actually have a designated time to mentor staff and to see the mother-baby dyads. So we find a lot of times in some of our clinics that we have people that wear multiple hats. They might be the breastfeeding coordinator, they may be the peer manager, but the real goal of this was that this is a separate position. This is a position that's going to provide breastfeeding support time. It wasn't just administrative. They needed to be able to see those mom and babies and have those designated times. Now, with all that being said, this still was an unfunded mandate, and there isn't a lot of designation of what that time looks like in the WIC program. So we have some smaller agencies that are choosing to do a variety of things to provide those services. So in our thumb area, where we have several rural counties, they are fortunate enough in 2 of the counties to be able to have IBCLCs already currently on staff within either their maternal health program, potentially with their WIC program. And so they're utilizing a method of telehealth. So in those agencies that don't have the IBCLC, they have contracted with the IBCLC or with the IBCLC's employing county to be able to use our internal emergency preparedness system to be able to offer those services. So the mom that may need to be seen by the IBCLC would come into the agency. The peer counselor would be there to sit with them and help with the technology piece. And then kind of like a Skype or a FaceTime, but over a closed system, the IBCLC is able to work with the moms. This does a couple of things. One, it provides services to an area that they may not get to. It also mentors the peer counselor or maybe the CLS that's in that clinic to be able to do some assessment of that. The other is just contracting. So if some of our areas don't have IBCLCs that they're going to be able to pay as a position, they're doing some contracting services to be able to say, well, can we pay you on a per visit basis? Can you have X amount of hours designated to provide services for our clients? So people are getting really creative to do this, but we're really excited that they're really starting to say, okay, this is a priority and it needs to be some designated time. Another exciting thing that's happening here in Michigan is that we were able, through the help of a W.K. Kellogg grant, work on growing the number of minority lactation consultants in our state. And so with this 2-year grant from Kellogg, we were able to hire 3 lactation interns, as we call them. And over the course of the 2 years, they will get their practice hours under a couple of different methods. One, they're doing part of their hours as we partnered for a clinical rotation with St. John Hospital. So with St. John, they are getting their clinical hours in a 12-week rotation and in the hospital and in their outpatient clinic. And then they're also getting their didactic hours through attending a course, their courses every Friday afternoon. So they do about an hour to an hour and a half of didactic time, and then they have also practice quizzes and practice tests to do that. And then their other part of their time for their practice hours are within the WIC program. And so they're all working hours as a peer counselor / lactation intern in the WIC setting as well. Now, because these ladies are kind of our guinea pigs, this is a paid internship for them. So they are all in the, 2 of the 3 are in the internship full time, and it's paid, and they have health benefits while they're going through this. We do have one of our interns that already had all of the science requirements to sit for the IBCLC exam, so she was able to do the internship part-time. And as she goes through this program, we just are helping the other 2 get the other science credits that they need, as well as the 5 kind of other classes, such as first aid and my OSHA training and things like that. So we're excited. We're hoping they will be submitting their applications for the exam coming up this fall and then sitting next spring. Another piece that's happening here in Michigan is that our Medicaid is now covering IBCLC services, which has its good and its bad. For those of you or anyone interested, I have put the link on the slide here, or you can just Google Michigan Medicaid lactation services and you should be able to find it. So a few things here in Michigan. It is a starting point. We're happy that these that they have decided that it's an important thing to have these services. A little bit of the issue that we have is just Medicaid. IBCLCs have to bill under the delegation of a physician, so they can't bill directly. And then IBCLCs who are also licensed RN or social worker that are working in our maternal health programs can bill for visits. So this was a little bit of an issue with our staff in our local programs who may be IBCLC and an RD, because registered dietitians are not licensed in the state of Michigan. They're not considered to be able to bill under our maternal health program. So we're still working on several issues with that. One of the shortcomings are the low rate for the services. So the billable service hours don't make it financially feasible for this to kind of be a job for somebody. There's no separate billing for IBCLCs, so you have to be under the delegation or in one of those programs. And then there's also the, as I talked to before about the RNs are excluded, or I'm sorry, RDs are excluded here in Michigan. And then finally, there is a limit for the number of visits and also for the age of the infant. So we're continuing to work on the policy to expand it a little bit to have them understand that sometimes moms need to see a lactation consultant and things happen when babies can be a little bit older in age. So our next steps here in Michigan, things that we're doing, we're working on what we call a community engagement project. This community engagement is looking to talk a lot about preparing mothers for maternity care, for the evidence-based maternity care practices in the hospital. We know if moms get off to a good start, they're more likely to continue to breastfeed. So as part of that, we've brought on our WIC programs, we're bringing on our maternal health, our hospitals are on board working with this project as well. And so the next is working on coordination with physicians and getting physician office education so that we can have that consistent messaging. We are utilizing the COFECTIVE materials, and we have trained all of our WIC staff in the 5-hour modules for the education, as well as offered an opportunity for hospitals to receive that training, and then we are providing some of the free handouts and material for them. The next thing that we're doing is looking at expanding and finding a sustainable method for an IBCLC internship that would be run through WIC. We do have a didactic dietitian program here so that it's kind of we worked really hard to kind of grow your own dietitian in the WIC program, and we have what we call our outstate dietetic internship, and we partner with Michigan State University. And as part of that, if there are people who have had their 4-year degree in dietetics but have not done an internship, we offer the opportunity for them to apply for some special designated spots that are for WIC staff only. And so through this program, the internship is paid for them. They get a leave of absence for some of their clinical rotations. And then at the end of that, as they when they pass the exam, they basically are making a commitment to work within the WIC program for 2 years prior to leaving. So we're looking at trying to do a model very similar to that for IBCLCs. We're looking this year to be the first year to be able to support some staff exam costs and having an application procedure for our local agencies to be able to apply for additional financial assistance for the exam. In Michigan as a whole, we're working on licensure. So several of our organizations, our Michigan Association of Lactation Consultants, and some of our other programs are looking at licensure, something that will be forthcoming in Michigan over the course of the next few years. And then also, as I said before, improving our reimbursement levels for the services that IBCLCs do provide. Right now, unfortunately, if like in our maternal health program, if a nurse does a visit, they get paid at much more of a substantial rate than if they go back in and do the nurse IBCLC visit. So, it really is counterproductive to have that. But those 2 lactation visits are separate visits, so there is the potential of them being able to see the mom more than the designated 9 times within the program if they add that. So we have a lot of things going on in Michigan. We're really excited. I said for years we've pushed this big rock up the hill, and now we're quickly chasing behind it as more and more people are understanding the need for breastfeeding and breastfeeding support. So we're looking forward to working and collaborating with Indiana and sharing ideas and then continuing the work in our state. So just wanted to share with you, if people have questions, want to reach out, have more information, just share my email address with you and my phone number. Feel free to use either. Email is probably the easiest because I do tend to be out in trainings a lot throughout the state. But if you have any questions or want more information about anything, please feel free to shoot me an email. And I think I'm going to turn it back over to Margie and have an opportunity for people to ask any questions of any of the presenters. Margie, I'm not hearing you if you're talking.
Okay, can you hear me now?
We can hear you.
Great, yay. Okay, gotta love technology. Okay, so thank you everybody. That was a great presentation, and as I said, I've been here about 4 months now, and Kathy, Tracy, and Julie, I so enjoyed hearing what you're doing and the specifics of how you're actually moving forward in our state. So I'd like to open it up to any questions that anybody has. You can type them in the question box on the right-hand side of your screen. And we did have one question for Kathy and Tracy, which Julie addressed a little bit, but the question was, do you have any plans to implement telehealth as a replacement for the 48 hours telephone follow-up? This would provide a face-to-face clinical encounter plus potentially increased revenue generation.
Well, currently that is provided by a WIC peer counselor, and we do not have any plans on using telehealth, but we do offer them the opportunity to come to the clinic And we do also have the option of referring them to our maternal and infant health program, which is a home visiting program, or our Healthy Start program, and all of those staff have advanced breastfeeding training as well.
Great, thank you, Tracy. If anyone else has any questions, feel free to type them in the box. Okay, a question came in. You stated that the teleconsultation in Michigan is provided through an already existing emergency system. Could you speak more to that?
Sorry, now I'm muted. So I don't know exactly. They call it their Polycom system, but I thought Polycom was their what those little units were called. So basically, after 9/11, all of our health departments were equipped with a emergency preparedness system to be able to talk under kind of a secure connection. So I don't understand a lot about this, but to my understanding, like Skype and FaceTime and some of those technologies, as that stuff filters through the air, there's people that were potentially could be able to get in on that or view that, or it's just not a secure setting. So one of the things that with what we're kind of calling like a telehealth is that it's utilizing that specific system. So it isn't as wonderful as like being able to have a mom, like, you know, call on her phone from home whenever. It still is requiring them to go into the clinic and use that internal system. So it's a step. I do know that there's some companies and other things out there that are offering like secured systems and other things to be able to provide this service on. Right now we said let's try to implement what we have in place and what we don't have to pay for. So I hope that answers your question. But I would check with your health department or your hospital if you're with one of those. Both of those here in Michigan have the ability to use this communication method.
Great, thank you, Julie. Another question came in. This came in late, I'm sorry. How many times would you recommend contact with a mom prenatally? I'm not sure if that was covered in the first 15 minutes.
So I don't know, this is Kathy, I don't know if I can answer that or not. We were including information in the OB and family practice offices so that their regularly scheduled OB visit included some of this breastfeeding support information during that visit. So they actually leave their doctor's appointment with some takeaways. I don't know if that answers that.
Kathy, I guess this is one thing that I was wondering, this is Margie. To the OB offices, do you provide like a checkoff list, or like these are the 10 major points that I would like to have covered with the mom on breastfeeding topics?
We actually have handouts for each of their visits, each of their OB visits. So one visit we may hand out something that is on rooming in and how that supports their breastfeeding success. Skin to skin, again, how that does contribute to successful breastfeeding. That magic hour after birth. The second night syndrome, those kind of things are what we cover, and they actually have a handout that they go home with. So we don't have a checklist per se, but we have it organized in this is what you give them at their first visit, this is what you give them at their second visit, so that it's all organized for them.
Wow, that's great. Good. Thank you. Okay, next question. This is for Julie. You said that the exam cost for IBCLC is covered. What about recertification fees? Do you support that?
We can, yes. Right now, we have allowed that under the local agency budget. So it was something that the local agencies were just putting in. Because this is like a new requirement for IBCLCs, we will be looking at that as well. So our goal is that we'll be able to fund at the state level about 10 scholarships is what we're starting with right now, and then we'll just see how that goes. But yes, it would be available for recertification or initial exam costs. And then if we run out of money, then we'll have to revisit it. But right now, I think that that's where we have.
And Julie, did you address specifically exactly where the funding comes from?
This was just something we've decided as part of our budget here at the state to support that. So we're using our general administrative dollars within WIC.
Okay, great. Thank you for that. We still have time if anybody has any other questions they would like to ask. Okay, and if there's no more questions, let's go next month's webinar, which will be on Tuesday, September 20th from 2 to 3 p.m. in Eastern Time. And the topic of next month's webinar will be hospital breastfeeding quality improvement, lessons learned from a national initiative. And again, thank you everybody for joining us today. We at the state of Michigan, we're so excited to be welcomed so warmly into the Indiana webinar, and we look forward to increased collaboration between our two states.